So testing is central to our strategy to combat COVID-19 in the Bailiwick, and that involves identifying a case of COVID-19 and then isolating that case and contact tracing around the case. And that means we prevent the onward transmission of COVID-19 within our community. So that's the strategy we've been using of flattening the curve. Now, the reason why we want to flatten the curve by testing and identifying positive patients is that we can then protect our hospital facilities. So we want to make sure that we don't breach the capacity of our hospital. And by flattening the curve, it means that we're better able to cope with people that need our care within the hospital. It also is important because it reduces the onward transmission of the virus within our community. Really important because we want to protect people's health and well-being. So our on-island strategy differs from the UK in that we've gone for widespread community testing. So rather than focusing on hospital testing, which the UK has done, we've focused on testing within the community. Now we feel that's important because it enables us to, as I've said before, identify positive cases and then put the appropriate contact tracing, isolation in place, and that prevents onward transmission. If I was sitting in front of you today, at the moment we've detected over 150 cases within the Bailiwick. In contrast, if I was following the UK policy, we would say that we detected 7 cases because that's how many cases we've had within the hospital. So an entirely different approach, but one that's focused on detecting positive cases, identifying them and flattening that curve.
So currently we're using a PCR test, so it's a molecular test. What we're doing is we're taking the swabs, we're then extracting the viral RNA, the genome from the swab, and then we amplify up that to detect it using a PCR kit. It takes about 5 or 6 hours from the extraction to get the final result. So once you factor in time it's taken to get the swab up to the lab and process the results typed up, we're looking at about 24 hours for turnaround time. We can do about 120 to 130 swabs in a day.
So in the beginning, I'm sure everyone will remember, we were focusing on very specific clinical symptoms. And so that was a fever or a cough or shortness of breath or any combination of the 3 together with a travel history. We've changed that strategy now. We know that we have some on-island transmission occurring within Guernsey, and that's really important. We've also done an analysis of positive patients presenting to us, looking at what symptoms they had, together with looking at the overall literature of how people with COVID-19 are presenting. And we've broadened our testing criteria. So now, in addition to a fever, cough, shortness of breath, we take into account other respiratory tract symptoms. So a sore throat is important. Other things like general tiredness, muscle pain, so flu-like symptoms are also important. Interestingly, another symptom that's come to fore is loss of smell and loss of taste. So really important. So we're looking out for those. We've particularly seen those in individuals who are under 50 years of age. Then if we look at how it's presented in our older population, we found that the presentation of COVID-19 may be atypical in the early stages. So just someone not being quite themselves, having a mild fever, a bit of a runny tummy, so things like that. And so we're looking for more non-specific symptoms in our older population.
So if you have to get tested, there are 2 main sites outside of the hospital where you can be tested. The first is down at the harbour, and the second is in Chest and Heart Clinic, which is being run by the GPs. If you're going down to the harbour, you'll get called up by one of the testing team, and they'll book you in for an appointment. Chest and Heart Clinic, you just contact your GP as normal, and they'll direct you there if they think it's necessary. The actual swabbing, they'll take a swab up your nose and a swab from the back of your throat, and that sample will get sent up to the lab for testing. Once we get the results back, the public health team will phone you out to tell you if you're positive or you're negative, and they'll give you advice as to what you need to do there.
So antibodies are produced by the body's immune system in response to invasion by some foreign substance. The body takes some time to develop those antibodies, typically 7 to 14 days and sometimes a lot longer. But once they're there, the laboratory can actually detect those antibodies in blood. And what that can tell us is if the patient's been exposed to the virus. That's different from what we're doing on island testing at the moment, which is actually a test that looks directly for the virus as opposed to the body's response to the virus. There's lots of people working on these technologies at the moment. Essentially, they're all working on technology that we're using in the lab at the moment, but they're just trying to improve on it. They're trying to make it faster and more reliable. The quicker we can obviously turn a result around, the quicker that the teams in the clinical side can act on those results. There's some more novel approaches as well. There's one test I'm aware of that is actually looking for antigen produced by the virus. It's not shown so much promise early on, but it's a fast developing field, so who knows, in a few weeks it could be entirely different.